Hi there, this is your Town of Islip Supervisor, Angie Carpenter, with our latest edition of Supervisor Spotlight. It's been a while. We're still functioning in this COVID environment, and this is our kind of temporary studio, a little bit more socially distanced we're able to be. I do have my mask, and since we're probably 10 feet apart, we're okay.
Yes.
And I'm so delighted to have with us today Dr. Chris Rayo, who is no stranger to us here on Supervisor Spotlight or in the Town of Islip. He's the head of the Emergency Medical Department at Good Samaritan Hospital and for Catholic Health Services. And boy, if this was a time to be in emergency medicine, you know, who knew?
It's been a bit wild. Thank you for having me.
Yeah. So let's go back. March, our whole world changed. You know, March 12th, 13th, whatever, you know, particular date. I know we were making decisions on March 12th about whether or not the St. Patty's Day parade in Bayshore should be canceled.
Right.
And you look back now, I mean, that was a no-brainer decision, but
Yep.
there was a lot of angst over it at the time because it was one of the first big events that were being canceled, and now, you know, we're hearing marathons and, you know, all kinds of celebrations, justifiably so, are being canceled.
Yeah, I mean, I think, you know, we are absolutely in a much better place today, which I think,
God, yes.
which I think is great. But you know, I don't think we've completely gotten through the pandemic, and I think that that's also important that people realize that.
You know, as sad as it is to see states around the country, you know, going and heading in the direction we were at, and states that were doing better, and now all of a sudden they're seeing spikes because they opened up too quickly. It certainly is a lesson for all of us that we have to stay the course. As painful as it is sometimes to, you know, wear the mask and do all of those things, it's so important.
So at the peak at Good Sam, we actually had 264 COVID positive patients back in
And how many
April.
beds do you have in Good Sam?
I mean, well over that.
No,
So
I know
we
it's
did-
over that, but
yeah.
when you think of the percentage of beds that were just COVID at the time.
Yeah, I mean, the majority of our cases at that point were COVID positive. Today, I'm happy to say we're down to 13,
Wow.
which I think is obviously great news for us and for the community. But we're still seeing what I would call mini outbreaks, and some of them are occurring in social gatherings, you know, parties, graduation parties, et cetera. So I think it's important that people still practice the social distancing, still wear the mask like you have there, because this is by no means over, and we really need to prevent that second uptick.
You know, I look at Newsday every morning and I look at the statistics and go to the targeted communities in our town that have experienced just a real high amount of cases, and we're still seeing 3, 4, 5 cases a day, you know, in some of the hamlets, and that's high. That's still high.
There's definitely still a risk, and unfortunately, people still can die from this. And I think that people need to realize, just because they're back to work, et cetera, that it's not back to normal just yet.
You know, you made reference to the fact that there were some, you know, outbreaks and linked to some parties, gatherings. You know, initially the recommendation was, you know, groups of 10 seemed to be, you know, a safe number to stay with, and then 50 for larger gatherings. But still, social distancing, wearing the masks, and people are having these backyard parties, and they're thinking because they're outside it's okay. And you look and no one's wearing a mask, and then you start partying, you have a few drinks, and all inhibition goes out the window, all, you know.
Yeah, I mean,
good
you know,
judgment.
being outside is certainly somewhat protective, but if you're, you know, 1 foot away from another individual who's positive, there's still risk, and we're seeing cases like this come into Good Sam and some of our other hospitals from people who, you know, were interacting with others at parties and large gatherings. I don't think, you know, we haven't been seeing as many critically ill COVID positive patients, which is obviously great.
Is
but
that because they're coming to you sooner, or they're aware of the symptoms sooner?
So, you know, I think people are definitely more aware, so they're probably coming in earlier. You know, I think there's obviously a lot less cases, so just by the numbers, we're going to see less. there are some theories that maybe the strain has weakened a little bit, and I'll be honest, I don't think anybody knows that for sure. So right now, we have to be protective, we have to be safe. If you're going to be around a lot of other people, you really need to practice that social distancing and wear a mask.
Something you just said, we don't know it for sure. There still are so many unknowns about the coronavirus that I think is going to make it so difficult.
Yeah, I mean, there are positives as well. We definitely are better at treating it. We definitely know a lot more than, day one a couple of months back when, honestly, it was a little scary. I think we're much better prepared, and we do have more information, but we don't have all the answers. And somebody might say they know this, that, but, I don't think anybody knows everything about this virus, and we still have to do research and, practice evidence-based medicine, and, everybody needs to be aware that it's not completely safe yet.
What I think, and I'm going to take away from it, what we do know is that there are some things that we can do to protect ourselves and protect others. The mask you wear is for you, but it's also for the rest of humanity, really. So wearing the mask and staying socially distanced and washing your hands, it's such a simple thing. And it's so easy to go back into the habit of not being vigilant about that.
Yeah, I think that protecting others is key. It is true that if you're young, healthy, with no other comorbidities, there's a good chance that if you contract COVID-19, you'll probably be okay. But it's really the protecting the others, and for the sake of the community, we just can't be spreading it. And even if you're okay, if you give it to 2 other people, one of those individuals may not be, and we need to be aware of that.
And if you talk to somebody who's had it, it's not a pleasant thing to experience. I mean, people are sick for weeks at a time, running fevers for weeks at a time. I know of someone personally who was out of work 51 days and ran a fever for 38. When you think about that, that's pretty severe.
Yeah, I mean, even the young and healthy, what we're hearing a lot is it's going to take 3, 4, sometimes 5 weeks for them to even recover. And, they're physically drained, they're exhausted. And the other thing, the we don't know part is we don't know all of the long-term sequelae and effects. So, 5 years from now, we might be sitting here talking about complications from people who had COVID, 5 years prior. So, we just don't know how this is going to affect people long term.
So it isn't the kind of thing, you want to have and think, oh, well, I had it, now I don't have to worry. You just don't know what might happen to you long term if you do contract the coronavirus.
Absolutely.
So again, the message has got to be that we've got to do whatever we can to stay safe and keep others safe.
Yes.
And I know you guys are doing an incredible job at Good Samaritan Hospital. There's so much happening there. And I think we're going to take a little bit of a break and come back, and you can tell us a little bit about what's happening at Good Sam, particularly the new Pediatric Emergency Department.
Excellent.
I'm here today with Dr. Chris Rayo, who heads up emergency medicine at Good Samaritan Hospital. Thank you.
You're watching ITV, Channel 18, Islip Television.
Hi, this is Town of Islip Supervisor Angie Carpenter welcoming you to Supervisor Spotlight. And we're delighted to, well, first of all, let me thank Long Island News Radio, JVC Broadcasting, that does send our show out to the public. We really appreciate that. Normally we were in their studios, but now we are taping in Town Hall in a very socially distant makeshift studio, keeping safe and following the guidelines for COVID-19, because Lord knows none of us want it. Dr. Chris Rayo is our guest today. He heads emergency medicine at Good Samaritan Hospital. And we were talking a little earlier about all of the exciting things that are happening at Good Sam, none the least of which is the new Pediatric Emergency. It just seems like a no-brainer that there be a separate emergency room for pediatric patients rather than the general public, because any of us who've had to visit the emergency room know how chaotic it can be, how frightening it can be to adults, much less a child.
Yeah, so we treat well over 20,000 pediatric patients per year.
Wow, that's phenomenal.
In our emergency department, and we're really excited to be opening our new pediatric ED really any day now. Could be tomorrow, we're hoping. And you're right, it's something that I think we thought about for a long time, and really it's a need in the community. There's nothing like it within the area here on the South Shore of Long Island. And it really goes along with what we're doing for the whole pediatric service line and pediatric program at Good Sam. We're an American College of Surgery pediatric trauma center. We're really capable of treating any pediatric illness or injury, and having this dedicated space is really, really important. It's not only important for the patient, but I think it's also important for the families.
Oh, absolutely. Absolutely. You know, you're standing there with a child and, you know, who has some sort of traumatic incident, you know, whether they fell off their bike or whatever, and you're waiting for them to be taken care of, and in the next bed somebody's, you know, older and moaning and screaming, and just not a really good environment. And as you're worried about them, you don't want them exposed to that. And
yeah, so this, you know, this is a brand new dedicated space. Just the overall environment of it,
I can just imagine.
the colors, you know, they're all private rooms, which, you know, I think is really, really important for all patients, but for pediatric patients in particular.
That's amazing. How many rooms are there?
So there are 12 dedicated rooms, and you know, I think that just the experience for these patients and for their families is going to be much, much improved, which is great.
Absolutely, absolutely. Well, we'll have to, I'm sorry I missed the grand opening, ribbon cutting, but, and hopefully I won't be visiting it with any patients, but certainly we'll be happy to recommend it.
Yeah, we also, you know, we have staff dedicated to that area, so we have physicians that are pediatric emergency medicine board certified. We have pediatricians who are available as well. We have nursing staff who are trained in pediatric emergency medicine and certified to take care of kids. So we've really put a lot of effort and resources into this, and we're hoping that it pays off for the patients and for their families.
Oh, I'm sure it will. And, you know, it seems like a no-brainer when you think about it, that in the educational system, teachers are certified to teach certain grades.
Absolutely.
And in the physician community, not everybody can deal with children.
Right.
Not everybody can deal with geriatric patients. So to have physicians that are dedicated, you know, to pediatric patients in this new ER really is going to make a difference, and as you say, be a comfort to parents and their family.
Yeah, I mean, everything that we did in the planning and design, et cetera, was really geared towards making it a better experience for the patient and the family. You know, kids, when they get sick, when they get injured, it's a very anxious moment for them and for their parents. So really everything in the design process was focused on making it a better experience, and obviously we felt like we always delivered high level care. That, you know, that's part of our mission, but now we have the space that matches that quality of care.
And I think throughout the hospital, throughout the entire environment at Good Samaritan Hospital, that seems to be the message that is being delivered to the community, to try to bring it to that level or maintain that level, you know.
Yeah, absolutely. I think there's been significant investment over the last 5.5 years that I've been there. You know, we really want to make it a place that patients and their families feel comfortable coming to. I will say, I think the clinical staff, you know, physicians, nursing, is some of the best people that I've ever worked with. And now some of the physical spaces has been upgraded, and, you know, brand new spaces in this case, and it's really matching that care.
You know what, and this is just recently, a friend of mine, her mom went to the ER, and she was texting me, and I'm like, well, how's she doing and everything? And she said that as frightened as her mom was, everyone around was so reassuring and friendly, and the staff, you know, just couldn't be any more solicitous of her. And that really makes a difference.
Yeah, I think
you know?
that the culture in CHS, and specifically at Good Sam, is pretty unbelievable. I mean, the team there is exceptional. And, you know, moving the pediatric ED to that brand new space, remember, now gives us a much bigger
Sure.
area even for the adult population. So it's going to have benefits on both sides.
How many beds do you have in the emergency department now?
So we have approximately 60 beds,
Mm-hmm.
and you know, now with that extra third space, it's really going to be able for us to spread things out and give
Mm-hmm.
a better experience for the adult patients as well.
Yeah. And, you know, it's certainly nothing that you can control, but when people have an emergency and they come to the emergency department, you know, if you have room for 60 and patient 61 walks in, you're not going to say, sorry, you've got to leave. There's no
course
room
not.
at the inn,
Right.
you know. So you do your best, and there have been times that, you know I've been there with someone that you go, oh my God, you know, they're just on, there's a lot of people here.
Yep.
But despite that, there always seems to be that one-on-one, you know, caring and nurturing. And
Yep. Yeah, I mean, it's a
really lovely
very
to see.
dedicated team of physicians, nurses, and ancillary staff that we're really very proud of. And I think going through this COVID pandemic, we had this new pediatric ED to look forward to. It actually gave us a little bit of a boost in morale to know that, you know, we were going to be working in this brand new space in a few months. So it
you
comes
know,
at a good time.
The state, the country, the world really was on pause. So I can imagine working in that environment with COVID and the pressures that it put to bear, to, like you say, have something happening despite all of that.
Yeah.
New construction, new, you know, capacity had to be very uplifting to
Yeah, and the
to
project
everyone.
was actually expedited because, you know, we saw a need now to have
Yep.
more private rooms and to spread people out. So it was interesting how, you know, we were a little concerned when COVID hit that this might be delayed, but we were actually able to speed up the project, which was great.
Well, let me just say something. We have to have a little plug here for our planning department because despite COVID, we were still operating. The town was told they had to be at 50% capacity. People had to work from home. 50% of staff had to be at home. So our planning department, as all of our departments, kicked into high gear to see how we could function. They put lock boxes out so people could drop plans off. We'd have people waiting outside while they did a cursory review to see
Right.
if everything was in place so that they didn't just drop it and then find out 2 weeks later you were missing 3 things. They looked at it real quickly and said, oh no, this is good to go. And we were able to see things like the pediatric department, you know, move forward despite, you know, the COVID pandemic.
Well,
And
we
that was
we
important
definitely
to us.
appreciate it.
Yeah, no, it was important to us at the town to see that happening. So I know there are other plans in the works for expansion at Good Sam, and it's something we'll probably talk about in the future. But on a light side, something that Good Sam has been involved with that we are so excited about is the fact that they have sponsored the Town of Islip Drive-In movie series this summer. And it has been so very popular, and we'll talk more about that when we come back from our little break. And thank you so much for being with us. We will be back.
You are watching ITV, Channel 18, Islip Television.
Hi, this is Town of Islip Supervisor Angie Carpenter. Had to hesitate there for a moment. We are here in our makeshift studios during our still COVID environment, unfortunately. We are so delighted to have with us again today Dr. Chris Rayo, who's the head of emergency medicine at Good Samaritan Hospital. Chris, your guys have done an incredible job, but certainly during these past, 4 or 5 months now, it just seems like forever ago, and then it seems like just yesterday. But so many things have been happening, and we started talking about a little bit before we took the break, but one of the things, because of COVID, we've always had movies in the town at the parks, not as many as we have this year, and not to the level that we have this year. It was a small little screen, and people would bring their blankets, but that wasn't something we could do this year. So we thought, what can we do? Let's try drive-in movies. And Good Samaritan Hospital was so very gracious and is sponsoring the entire series for the town. we have been all over the town, and we still are going through a good portion of September. And again, Good Sam is the sponsor and is bringing real, live, happy family entertainment. Families are coming, kids are coming, teenagers are coming, young adults who've never been to a drive-in movie before. And we had our first at Bayshore at the Westfield South Shore Mall. They hosted it. And it was kind of cool because Bayshore was the home of a drive-in movie many, many years ago. So we'll be going back there again, and just great movies, great family movies. So look, Monday nights, sometimes Friday. We have a rain out at the mall on a Thursday, but check the website, check your recreation news for the timetable for all of our movies. So again, thank you, Good Sam. But, you know, we talked about it in one of our first interviews about the fact that one of the effects of the pandemic that we might not know for a long time is the fact that the normal kinds of things that people were doing, whether it's a mammography or, you know, going to the dermatologist for the annual checkup, people were putting off, you know, really didn't have a choice but to put it off initially. And that, unfortunately, is going to have some effects.
Yeah, I think, you know, you're mentioning a lot of the preventative medicine stuff, and I think a lot of that was not getting done early on. I think a lot of the health systems stepped up and started using a lot more telehealth. So they intervened with telehealth when they could, but there certainly was a lot of preventative medicine that was not happening at its normal pace. More concerning to me as an emergency physician is we started to see a decrease in cases of really pretty much everything. So even patients with chest pain or, you know, pneumonia or, you know, really every diagnosis across the board we weren't seeing, which, you know, those things were still happening. What it means was people just weren't coming to get the care that they really needed. I think obviously there was, you know, a big fear factor involved. Nobody wanted to come to potentially contract the virus. What we know now is that the hospitals were actually relatively safe. You know, we did have a few physicians who got sick, none of them seriously sick, thank God, but the majority of individuals did not contract the virus even working in the hospital. The majority of us, interestingly, weren't even antibody positive, so we didn't even have
that's interesting.
Significant exposure. You know, and now I think more than ever, people need to know the hospital is a safe place. If you're sick, if you have symptoms that you think you need care, you need to get to the hospital, because we don't want to see people presenting later in the disease course for something that could potentially, you know, create complications, create morbidity, or in some cases people could die if they don't seek that care.
You know, you mentioned that the hospital is a safe place. You know, there have always been protocols for infection control in hospitals, and they have to adhere to a certain standard to maintain their accreditation, and those standards are very, very strict and very closely monitored. Then COVID hits. So I would imagine, if anything, everybody's up their game.
Yeah, I mean, things have gotten a lot tighter. You know, the PPE that everybody was reading about, you know, people thought it might become an issue that we would run out of PPE. That never happened. You know, the response, I think, was actually pretty good. And now, you know, we're in a good place with PPE, not only to protect the patient, but also to protect the staff, which, you know, is important.
And I think, you know, even from our perspective as an employer, I know that we have stepped up our game as far as, you know, the protocol for disinfecting and cleaning everything, doorknobs and, you know, all touch point areas. I know that at the airport, we instituted this Casper technology, which I believe is something that's used in some of the hospitals, that removes 99.9% of the pathogens from the air and surfaces.
Right.
And they also got this Silver Defender, which is a film strip that goes on any high touch areas in the bathrooms, on vending machines, et cetera. We even actually installed a vending machine at the airport that has PPE equipment in it. It's got wipes, it's got, masks, so that if somebody forgets, their hand sanitizer or what have you, they can grab it at the airport before they go to TSA.
It's not just the equipment. It's also the processes.
Right.
So we, at all the CHS sites and specifically Good Sam, we have processes to screen patients for symptoms or for exposure to COVID. In addition, we also screen our staff. So when they come, we don't want somebody from our staff who's contracted it to come into work, obviously. And then, once they're in the department, we're keeping people as separated as we possibly can. All patients who are staying within the hospital get tested for COVID. So it really is a safe place, and if people need care, they need to get to the hospital.
And, when in doubt, err on the side of caution and get checked, because, whether it's, heart, stroke, and that is so prevented, the long-term effects of stroke can be prevented if you get somebody to the hospital fast enough. These are the kinds of things, and even, I talked about going to the dermatologist or, the dentist, or the periodontist, any of the things that you were doing routinely, it was probably convenient. And I can speak from personal experience, say, oh, well, I guess I don't have to go now, I can't go. Right. But don't put it off.
Yeah, we did unfortunately see a lot of cases of people who had, abdominal pain or, chest pain, who waited maybe an extra day or an extra 2 days and then wound up coming in, and we, for example, found somebody with appendicitis who normally would have come in 2 days earlier, and now it's a much more serious condition. So I think people need to know, it's safe. Come in, get evaluated, see your primary care doctor if that's appropriate, but don't avoid care for fear of contracting COVID.
You cannot emphasize how important preventative medicine is.
Absolutely.
To not get you to that, critical point where it's too late to do something. If only we had come in sooner, if only we had known sooner, the outcome would have been different. You just don't want to see that. So if anything, hopefully the takeaway from today is please take care of yourself and be safe and, wear the protective equipment and all of those other good things that we've been talking about. I just want to ask you, we sort of touched on it a little bit when we started, but being an emergency medical physician, could you ever in a million years have envisioned what you've gone through these past months?
No. I think we've seen some similar scenarios in movies and such, and I think when this all first started, I think we never thought it was going to get to the level that it got to. It's certainly been an experience. I think there's a lot of positives that are going to come out of this. I think from the medical side of things, we're definitely going to be more prepared for anything that we hit in the future. I think for other illnesses like flu, I think now we know that masks work, we know that social distancing works, and that's going to help for things like influenza and other communicable diseases. The other thing I think I learned is that in the toughest of times, you really see what people are made of. And
it's brought the good out in everyone.
I think at Good Sam, I can say, 100% of the people stepped up, and it was really incredible to see.
Well, Chris, thank you so much for being here. And again, and I want to take away something that you just said, something good is coming out of all of this. It really is. And I do believe that we're going to be a kinder, gentler society, more appreciative of one another.
Absolutely.
And just kinder to one another. And I thank you so much for watching. I thank you so much for being here, Chris.
Thanks for having me.
And we'll see you next time on Supervisor Spotlight. Thank you.